Being off meds, they were much more alert and functioned better in school and were much happier kids all around. 3 years after having suffered a stroke, at the age of 5, Nikaya's only word is still a very breathy hi.
Good girl, Nikki.
But then she started doing something that none of the doctors thought she would ever do. Using her younger sisters as role models and not wanting to be left behind or stuck in a wheelchair, Nikaya started to walk. Being on the diet made her gain a little weight, and we knew it could have long-term adverse effects on her liver and kidneys. But she was happier than ever before, and for parents of a sick child, that's all you can ask for. Of course, all good things come to an end, and they started having more seizures and were placed back on the meds. But not all was lost. Nikaya now had one of her favorite foods back: French fries. When you have two identical little critters getting into everything, it's easy to miss some things that are so evident when you look back at these videos. After 2 years of these little monsters running around the house, yelling, screaming, laughing, I realized that all the noise was coming from just one of them. Ashley would usually just point to something she wanted and move her lips. But Alyssa actually would talk.
Coat on the snow.
You need a coat on because it's snowing out?
Yeah. Mommy, got a coat on.
We're not going out in the snow yet. We just woke up. We haven't even eaten breakfast yet.
Here we go again, another trip to a specialist. After some basic testing at the local audiologist, we took the twins to Dartmouth Hitchcock Medical Center to see what was in store for us next. We didn't need a doctor to tell us what we could already see by the readouts and the lack of response in Ashley, and we knew what we had feared in our hearts was true. Alyssa had a lot of trouble hearing us and was predominantly deaf in one ear, and Ashley couldn't hear us at all. Being deaf is a major challenge in a hearing world, but it is much easier to wrap our heads around what we need to do as parents. We needed to learn sign language in order to communicate with our daughter. Not only did we need to learn sign language as parents, but everyone around us and everyone that would encounter Ashley within a day would need to know a little sign language. Since our small state doesn't have a deaf school, we had to have her IEP require a sign language interpreter. But how do you interpret to a 3-year-old who has no base of language? So Ashley's elementary school hired an interpreter who also had to be Ashley's deaf educator, who turned out to be one of Ashley's biggest role models. 12 years later, Christina still takes time out of her busy schedule to join Ashley at different public events and translate whatever she needs translated. Like teaching any new child, there's always the signs that you really have to know. Our dog Copper even started to learn sign language. Sit, no, eat. It worked. Ashley's need to learn sign language to communicate with the world also helped Nikaya, because Nikaya had never learned to speak. Nobody knew why. Might have been the muscles in her throat never got enough mitochondrial energy. It might have been her stroke. So we started teaching her simple signs, like eat, drink, thank you, and of course no. Just as we were getting used to sign language, Alyssa threw in the next big curveball that would affect our daily lives. After being misdiagnosed as lactose intolerant, more tests were done, and we found out she had type 1 juvenile diabetes. A few months afterwards, Ashley also tested positive for diabetes.
What I want to do is give you a little overview of UMDF. and thank each and every one of you for taking the most important step towards a cure rather than become a victim of the disease. And I think that's what's most important, is that we realize that, you know, when a doctor tells us that there is no cure, that doesn't mean there's nothing that we can do. And so those of you that are here tonight have chosen to be part of the cure rather than a victim of the disease, and I think that's very, very important. So I applaud you for being here tonight and taking that first step.
Mitochondrial disease is an umbrella, and in some cases, for rare diseases that tend to affect kids, like really severe diseases, there's one defect, and that defect causes the mitochondria to malfunction, and then you get a whole bunch of different problems. Now, common diseases like Parkinson's or diabetes or autism, in some forms of those common diseases, mitochondria are malfunctioning. Now, we don't know whether mitochondria are malfunctioning as a cause of the disease or as some consequence of the disease. So that's a very active area of research right now. While the diagnosis, I think, may be 10 years off, the therapies we may be talking decades, unfortunately.
Since Nikaya was 4, we were told that she would have a short lifespan. We've been told this about the 2 oldest kids, but it doesn't make it easier as they progress on in years and they start advancing with other problems that most 60, 70, and 80-year-old people have, like dementia. It gets harder and harder to understand what you can do next, so we spend every minute we can with them, make every minute count, because there's a fine line between spoiling our kids and making sure every second with them is treasured.